Yeah, hi everyone. Welcome to my channel. My name is Dr. Wang, and I am here today to talk about ginger and its benefit. Ginger adds a fragrant zest to both sweet and savory food. The pleasantly spicy kick from the root of Zingiber officinale, the ginger plant, is what makes ginger ale, ginger tea, candies, and many Asian dishes so appealing. What is ginger good for? In addition to great taste, ginger provides a range of health benefits that you can enjoy in many forms. Here is what you should know about all the ways ginger can add flavor to your food and support your well-being. Health benefit of ginger. Ginger is not just delicious. Gingerol, a natural component of ginger root, benefits gastrointestinal motility, that is the rate at which food exits the stomach and continues along the digestive process. Eating ginger encourages efficient digestion, so food doesn't linger as long in the gut. So you see now, while I always encourage diabetic patients to eat more ginger, and the quantity of ginger I recommend at one go is 50 milligrams. That's the max that you can take in order not to create more complications, because when your blood sugar is not controlled, you undergo what we call gastroparesis, which I did explain in one of my videos. So gastroparesis is slow stomach emptying. Most diabetic patients suffer from this condition because their sugar level is not well controlled. So they end up in a situation we call neuropathy. So the nerves are dying down. So we are referring to the micro nerves here. When they die down, that's what happens. So they tend to constipate. So that's what happens. So ginger now helps the stomach to function properly. Nausea relief. Encouraging stomach emptying can relieve the discomfort of nausea due to chemotherapy. Experts who work with patients receiving chemo for cancer say ginger may take the edge off post-treatment nausea, and without some of the side effects of anti-nausea medication. So you see now, there's no point putting you on ondansetron, because ondansetron, that's what we use in the Western culture when it comes to chemo. So we use this one now because they develop nausea when they are using those chemotherapeutic medication. Another good example here is pregnancy. That you women throw up in the morning when they are pregnant in their first trimester. Vomiting is quite common. So we usually put you on a drug called Gravol. So Gravol is another one. If you have the money to buy the Gravol from the pharmacy, which contain pyridoxine, then that's good. Otherwise, I will say make use of ginger and things should be fine. So for generations, women have praised the power of ginger to ease morning sickness and other cuisines associated with pregnancy. Even the American Academy of Obstetrics and Gynecology mentions ginger as an acceptable non-pharmaceutical remedy for nausea and vomiting. The other factor here is bloating and gas, what we call flatulence. Eating ginger can cut down on fermentation, constipation, and other causes of bloating and intestinal gas. Wears and tears on cells. This is another one also very important. Ginger contains antioxidants. These molecules help many free radicals, which are components that can damage cells when their numbers grow too high. Is ginger anti-inflammatory? That's the question. It is possible. Ginger contains over 400 compounds, and some of these are anti-inflammatory. More studies will help us understand or determine if eating ginger has any impact on conditions such as rheumatoid arthritis or respiratory inflammation. Now, ginger exists in various forms. We have ginger in powder, ginger in tea, ginger in ice cream, and lots of other things. So we will treat just ginger tea benefit. Ginger tea is a fantastic thing. It is very important in cold months and delicious after dinner. You can add a little lemon or lime and a small amount of honey and make a great beverage. So here, I think we need to be cautioned here when you talk about the ginger tea with honey alongside. Do not, for any reason, put honey in hot tea. It doesn't make sense. It's detrimental here. So I would recommend anyone allow the tea to get cold. Then you put now a spoon of honey or whatever quantity that you want to put. If you are diabetic, I would say caution is needed here because honey has a glycemic index of 58. Though it's low, but frequency can be of concern here for diabetic patients. Commercial ginger tea bags are available at many grocery stores and contain dry ginger, sometimes in combination with other ingredients. These tea bags store well and are convenient to brew. Fresh ginger has strong health benefits comparable to those of dry, but tea made with dry ginger may have a milder flavor. Making ginger root tea with fresh ginger takes a little more preparation but tends to deliver a more intense, lively brew. How to make ginger tea? It's easy. Here we go. Buy a piece of fresh ginger. Trim off the rough nuts and dry ends. Carefully peel it. Cut it into thin, crosswise slices. Put a few of the slices in a cup or mug. Pour in boiling water and cover. To get all the goodness of ginger, let the slices steep for at least 10 minutes, like so. The content can get into that water, what we call in pharmaceutical preparation, percolation. So when you percolate these ginger slices, you get a good dose of the beneficial ingredients there. Ginger tea is a healthier alternative to ginger ale, ginger beer, and other commercial canned or bottled ginger beverages. These drinks provide ginger's benefit, but many contain a lot of sugar. So be careful here. Like I said, if you are diabetic, prepare yours at home. It may be better to limit these to occasional treats or choose sugar-free options. Now, let's compare ginger root versus ginger powder. Both forms contain all the health benefits of ginger. Though it's hard to beat the flavor of fresh root, ginger powder is nutritious, convenient and economical. Yeah, because you can just pick it from the shop or grocery store, which is already available, and you keep going. So that's the positive thing with regards to the powder form. You don't need to be chopped down or anything. You just get it that way and then put it in your tea and get going. Fresh ginger lasts a while in the refrigerator and can be frozen after you have peeled and chopped it. The powder has a long shelf life and is ready to use without peeling and chopping. Ginger pasta can stay fresh for about 2 months when properly stored, either in the refrigerator or the freezer. Should you take ginger supplements? That's another question here. Ginger supplements aren't necessary, and experts recommend that those who want the health benefits of ginger enjoy it in food and beverages instead of swallowing ginger pills, which may contain other or unnoted ingredients. They point out that, in general, the supplements industry is not well regulated and it can be hard for consumers to know the quantity, quality, and added ingredients in commercially available nutrition supplements. For instance, the Food and Drug Administration only reviews adverse reports on nutrition supplements. People should be careful about nutrition supplements in general and make sure their potency and ingredients have been vetted by a third party, not just the manufacturer. So essentially here, before you engage yourself in using ginger, I will say speak with a pharmacist. They are able to tell you what to do, that in terms of dosaging, because as I said, it is 50 milligrams the recommended dose to take in one go. How to eat ginger? In addition to tea, plenty of delicious recipes include ginger in the form of freshly grated or minced ginger roots, ginger pasta, or dry ginger powder. Ginger can balance the sweetness of fruits, and the flavor is great with savory dishes such as lentils. Pickled ginger, the delicate slice, often served with sushi, in another option. The sweet, tart, spicy condiment provides the healthy components of ginger together with the probiotic benefits of pickles. And compared to other pickles items, pickles ginger is not as high in sodium. Are there side effects? Definitely there should be. So let's see. Ginger side effect. Research shows that ginger is safe for most people to eat in normal amount, such as those in food and recipes. However, there are a couple of concerns. Higher doses, such as those in supplement, may increase risk of bleeding. So that's another thing here. You need to be very careful here, especially when you are on blood thinner medication and you're taking ginger together. It can be really disastrous. The research isn't conclusive, but people on anticoagulant therapy, blood thinner, such as warfarin, aspirin, and other, may want to be cautious. Studies are exploring if larger amount of ginger may affect insulin and lower blood sugar. So until more is known, people with diabetes can enjoy normal quantity of ginger in food, but should steer clear of larger dose ginger supplement. So that's the information I have for you. For any question about ginger or any other food ingredient and how it might affect your health, a clinical dietitian can provide information and guidance. So far, so good. Please send your questions and I will be more than happy to answer them. My name is Dr. WAN, and once more, thank you for listening to my clip. Share the video with your loved one. Ciao.